minus pharmacology. We won't be discussing the pharmac part. Otherwise, you'll be learning about what exactly is the primary hypertension as if you were into final MBBS. The whole idea is that once you have learned how the blood pressure is regulated, so knowing this thing will enhance your enhance your interest. Because next time we'll be taking secondary hypertension, and that is where I'll be showing you some of the radiological aspects. So how the patients, when you take the X-ray, what would be the effect of this hypertension on the X-ray images? That is how the heart can be affected. We'll also see some of the angiographies. So I'll just compile everything for the next time. In a minute, we start. How much is the presence? That is. Surprisingly, I haven't received much of the mails. There were only 6 emails. Till date, there were only 6 emails regarding the timings part. Currently, what is going into your colleges, in universities, for those where the lectures have started? What topics are in progress? Latin, Georgian, and research. Neck in anatomy, Nirman? You said head and neck? From head and neck have they started? Then, Rishikesh, because I don't record any of the lectures, so I don't have any recording. I think I got your email also. Okay. And Nirman, basic, then back, then head, then neck. I mean, okay. One, yes. It's surprising because for anatomy, starting straight away with head and neck, even if it is vertebra, it is not very comfortable. And Latin, Georgian, and scientific research. And what is this scientific research? I mean, sorry, but I don't know what it is. Scientific research means, is it something related to genetics or what it is? Let me know. Okay. So I think research part is so boring, only PPTs. Must be, because that's what I'm asking. What is that research? Scientific research means research of what? They completed head in 2 lectures and neck in 1. That's it. One of the reasons was to win Nobel Prize. Say that. This is the reason I hate PPTs. Many times I have been criticized strongly that "Kyun likhna?" But actually, it is like when you write, say, even if we say na, hello, so you know how the brain functions. As soon as I start writing HE, your brain has already said that yes, it is hello. So when the entire thing is finished, all those neurotransmitters they are released, Protein chains are synthesized and you remember it for a longer duration. कोई बात नहीं. Let's start with our today's topic. Yeah, I understand. Yeah. So we were talking about the blood pressure. Right? Blood pressure. When this blood pressure is more, then we call it hypertension. One of the silent killer. When do we say that the blood pressure is more? Well, that is when we say that we have got systolic blood pressure and the diastolic blood pressure. Systolic blood pressure is, that when it pumps, right, the force with which the blood is injected into the aorta. So that is the pressure. Diastolic pressure is like a preload, the gun which is loaded, right? Preload. So if the weight is right from the beginning more, so that will be a trouble. Right? So in general, when we measure the blood pressure, and if it is more than systolic more than 140 over diastolic 90, right? When we say that it is normal, so it is 120 by 80. So thus 20 points liberty given over here and 10 points liberty given over here, systole and diastole. So then we say that this patient is of a hypertension. Important is that there is severe diurnal variation. Diurnal variation is that in a day, this blood pressure changes so many times. Right? Even when you run, even walk, right? Even when you breathe, it is said that if you really want to decrease your blood pressure, one of my very good students, but he said that he is appearing for his USMLE. So he said that everything has been studied, everything fine. Now, before exam, just one tip. What should I do to decrease the anxiety? This is what I said. Do this. Box breathing. In, hold, out, that is breathe out, and hold. The duration should be same. As per your comfort, 4 seconds, exactly. Wonderful. So 4 seconds, start with 4 seconds, 4 seconds, 4 seconds, 4 seconds. Now, those who are into gym or those who are into running, you'll be having more efficiency. So instead of 4 seconds, you move on to 5 seconds. But then it has to be 5 seconds round the clock, 5, 5, 5, 5. Still more, you can increase it. And this is one of the best thing. Not only it will increase your VO2 max, right, your ability to utilize the oxygen, it will also lead to decrease in anxiety. Very useful when you will be appearing for the exam. So just before any of the exam, or even just before you start, just before you even start your study session, do this thing for just 1 minute. Till late, I do this technique. If you study one, very nice, very nice. Because if you are doing it regularly, it will become part of your body system. So next time, it is called as the neuro-linguistic programming. You are really talking to your brain and you are conditioning your brain in such a way that next time you do this breathing, and immediately you will be into a transcendental stage, a different stage where you will not be tired and you will be able to focus and you will be able to work effectively for a very long duration, right? So, okay, this is like diurnal variation, that is the variation in the entire day where it keeps on changing. It's your clinic and you need to take at least 2 measurements before you really stamp that this is a patient of hypertension. Okay, so we have understood that blood pressure is more. Blood pressure is more. You have measured it. This word will keep on coming. It is called as the etiology. Etiology. So etiology means why it is occurring. Divide it into 2 parts. Today we'll be discussing what is called as the primary hypertension. Primary hypertension, its other name is also called as the essential hypertension. Essential hypertension. I mean, we remembered essential hypertension is like wo to hona hi tha, right? If these are the things someone is doing, to blood pressure badhna hi tha. So this is what is called as the primary hypertension, which is comprising of 90% of the patients, 90%. But there is one more type, which is called as the secondary hypertension. It is a bit complicated. secondary hypertension when the hypertension is because of some other cause, right? So that remainder is the 10% of the entire case, but mostly it is the primary hypertension. Now we take it like this. There are some risk factors. When we say alcohol, right? Alcohol. So does it mean that every alcoholic is 100% hypertensive? Not necessarily. The way it is said that when person smokes, the chances of carcinoma of lung that increases. But does that mean that everyone whosoever is smoking will be having carcinoma? Not necessarily, because there are several other factors which are like your basic immunity. So whenever someone argues that I know a person who is smoking since 30 years and 40 years and still nothing has happened. The thing is, by God's grace, his immunity and his body function were so strong that he was able to resist. But no one knows. It is exactly like that there is one Pehlwan, a boxer, very much good, right? And so this is the boxer one, right? And the boxer two is hitting one after the other, so many punches, and still he is standing. Fine, he gets tired and he goes away. Then a child comes, bachcha chota sa, right? A child comes. He just touches and this person collapses. So does that mean that this child was having so much of power? No. He was on to that threshold that only the touch was needed and he collapsed. So actually it happens, like many times people say, "Kare, he was absolutely fine, or bus just एक cigarette पी और गिर गए, एक glass लिया." The thing is that their immunity, their resistance, body resistance was down to that level that only एक बहाना चाहिए था and he collapsed. So risk factors means where it increases the probability of occurrence of that particular condition by multiple times. So risk factor is something people don't even take care of. Say for example, alcohol is one of the very common reason of hypertension. Now as you will be traveling abroad, you will find that यहाँ ठंड है, ये है, all those things, right? सब बहाने हैं, सब बहाने. जैसे ना पीने का बहाना, मतलब दुखी है तो या गम गलत करने के लिए, खुश है तो चलो लेट्स सेलिब्रेट, और जब कुछ भी नहीं है, नीदर right? So the liver, he has to process. You know, there are some, I don't remember the number, but there are so many advantages. There are advantages of smoking, meaning heavy smoking, right? Heavy smoking. There are wonderful advantages. Means it is like कि आपके घर में कभी चोरी नहीं होती, right? उसके बाद आपके पीछे कभी कुत्ते नहीं पड़ते. देन जो स्मोकर होते हैं कभी बूढ़े नहीं होते. सो मेनी एडवांटेजेस. मतलब चोरी क्यों नहीं होती? वो पूरी रात खो खो खांसता रहता है बेचारा. चोर क्या आएगा कि यार कोई जाग रहा है, राइट? बिकॉज ऑफ स्मोकिंग बेचारे की कमर, बेचारे की, यू आर नोटिंग दिस, बेचारे की कमर झुक गई, राइट? तो वो लकड़ी लेके चलना पड़ा, तो यार कुत्ता क्या उसके पीछे आएगा, राइट? सो दैट इज आल्सो नॉट देयर. एंड कभी बूढ़ा नहीं होगा, जवानी में ही मर जाएगा. सो ऑब्वियसली दीज आर लाइक different things. So many things. At the end of the lecture, you can still the formula for calculating the proper range of. Sure, Durgesh मुझे याद करा. Just remind me in case if I forget, I'll definitely do that. So these are the advantages of smoking. So see, alcohol is one. Obesity, if the weight is more, right? This is. So obesity, this is one of the worst things for hypertension. For hypertension, and then we'll be discussing the diabetes. तब भी we'll discuss. मतलब you just reduce, if someone is having diabetes, right? If he or she reduces his or her weight by just 3 kilogram, the glucose, right, blood glucose level, it drops by 10 points. Such a big thing. Similarly, over here, the loss of 5 kilogram of weight, and if someone is hypertensive and its systolic is 160, it drops by 20 points. It comes to 40. Because when it is obesity, the amount of, there is so much of resistance, the amount of pressure with which the blood has to travel through those fatty areas. So this is alcohol, obesity. Third is lack of physical activity. So we write it like this, correct? And we say lack of physical activity. So easy to remember, it is this. Because whenever you do any of the sports, jog, run, it will improve your cardiac efficiency. And at the same time, we'll see it in more detail that how it really keeps your arteries very clean. More important thing, I have kept it with you, and this is high salt intake. And in high salt intake, those French fries, right? French fries. People eat this thing, almost French fries and burgers. Nasane, I never eat, right? I also do eat, kabhi. But when you do this, you need to be cautious that yes, the amount of salt which you are consuming is 4 times or 5 times than what is required for the entire day. They add extra salt, then and then it becomes tasty, right? Then and then it becomes tasty, and when it is tasty, because it's salt is such a thing. Salt and sugar, when they are kept on your tongue, so they release so much of saliva, and that makes things very palatable. So that's the reason high salt intake, you'll find in most of the bahar ke khane mein there will be high salt intake. So take care of this. I will be going in depth about it. Then, yes, if there is family history, daddy, mama, dada, dadi, if anyone is having hypertension, beware. Aapko aa sakta hai, because there is a very strong family history associated with it. Now, it is not so that, say, if there is family history and you take proper care of yourself, nothing will happen to you. Nothing. But yes, don't settle it. एक बार आ गया blood pressure या एक बार diabetes आ गया, then it would require 10 times more efforts to handle it. And obviously, this is like African and Americans. So it's this particular race, they have got more cases of this hypertension. Few questions have come up about the keto dieting. In keto dieting, when it is said that yes, if it is extremely restrictive, then amount of carbs which someone has to consume is less than 20 grams per day. Lower the better. Okay, right? When you consume so less, so there would be appearance of ketone bodies into your blood. Ketone bodies. There are people who survive on this, but when they say keto diet or paleo diet or this on API diet, it is okay for some short duration. But for keto diet, it is like if you are restricting the carbohydrates, like if you have to cut down sugar, that is the glucose level, right? If you have to cut down, so yes, if you cut down carbs, definitely this thing would come down, because fat is not making the sugar. It is the carbohydrate which is making the sugar. Protein is not making the sugar. It is the carbs. But it is very difficult to sustain. This is like not putting petrol into your car. Carbohydrates, there are good carbohydrates, there are bad carbohydrates. So the important is set the diet in such a way which you can follow easily, you can follow consistently and with pleasure. because दुखी होके कोई भी चीज करेंगे, so it would be very, very बहुत मुश्किल. How to lose weight effectively? As I said, just Ruchita, remind me at the end, right? We'll talk about this because this is the answer. That zone 2 wala answer. This weight loss and keto dieting and few more questions, right? जो अभी आप लोगों ने पूछे, तो answer of it is combined answer of all of this. Right? So these are what is called as the risk factors. Risk factors is something where the probability increases. Out of all of these, and everything is fine, but high salt intake. And when it is said that high salt means we are talking about the sodium chloride. So high sodium intake, when it is high, so simply high sodium, this will lead to what? Increase plasma osmolarity, right? Osmolarity, that is increased. When that is increased, it means the water has to come, right? When water has to come, and water will come in two ways. One, the antidiuretic hormone. Why so? Last time we studied that if there is increased plasma osmolarity, so it will go up into the brain, and there are centers, right? There are centers. So there are osmoreceptors. Osmoreceptors will say so much of sugar, so much, sorry, not sugar, so much of salt, so much of sodium. Don't let the water go, otherwise the concentration will increase. So what will happen? Diuresis should be stopped. So increased antidiuretic hormone. Antidiuretic hormone will say will go to kidneys and will say take that water back, right? If a person eats everything, even junk food, but in limited quantity, proper time, the person has chance of Khushi. Definitely, yeah, I'll answer this question, but at the end. Right? Her question is very good. If a person eats everything, even junk food, but in limited quantity and proper time gap, and that person does good exercise, then is there any chance of hypertension or diabetics or any other disease? We'll definitely address this thing. जैसे कहते हैं ना कि रोज का एक पैक पियो 30 ml रेड वाइन, इट इज गुड फॉर द हार्ट, बट 30 ml के बाद रुकता कौन है? That's the point. And what is good exercise? That is also very important because it varies from person to person. We'll come to that. So this is increased ADH, right? If there is increased ADH, so obviously there will be increased water into the system. When there is increased water into the system, there will be increased extracellular volume, correct? And when that is increased, so this means what? This is something which is into the plasma, right? So that it leads to increased blood pressure. Why it has to? मतलब ज्यादा सोडियम है तो फेंक दो ना बाहर, right? Let it go. No, can't, right? Because plasma sodium, it is kept in our body in a very strict concentration. So if the more sodium is taken, there is one method is throw it out, but the easier method is because of water always follows the sodium. So water will come and will dilute it because electrolytes, they cannot cross the semi-permeable membrane. It is the water which can cross, right? So plasma concentration is to be kept strictly at 140 millioverl per liter. This is so when you are consuming more sodium in the form of more salt, right? ये French fries, burgers, उसके में भर के डालते हैं. So the price which one is paying is increased blood pressure, so that sodium concentration is kept okay. Right? Because if the sodium concentration increases or decreases, there would be dangerous effects on the body system.
Coastal USA.
Dangerous system. The next one is when we say hypertension. So then what can really occur? The question which was asked last time. So this is what is called as the hypertension associations. What can really happen? One of the most dangerous things, stroke, brain stroke, right? Brain stroke. Second, in the form of heart disease. These are the two areas which are very sensitive. And in heart disease, two things can occur. One, what is called as the myocardial infarction. Right? And the second is heart failure. Layman would say heart attack and heart failure, they both are same. Right? They will consider it like that. But no, you know that infarction means lack of blood supply. Lack of blood supply. It means the coronary arteries, they were somehow clogged and they were unable to supply the blood to the muscles of the heart. So that's why that area died and heart stopped functioning. In case of heart failure, it can be right heart failure or it can be left heart failure. When there is right heart failure, that means extra load was put onto the right heart. Extra load. Right? When extra load, so why? Because from right heart side, pulmonary trunk is going. Pulmonary trunk is going into lungs. Now, lungs, for some reason, there is a mass. Right? There is a mass and blood is unable to go into it. It is compressing. So there is a back pressure. Increased back pressure has led to right heart failure. Something what is called as the core pulmonary. Right? Core pulmonary. Or over here, when there is aortic stenosis, right? And very tight aortic stenosis, very tight aortic stenosis. So in that tight aortic stenosis, the amount of blood which is to be pumped out of the left ventricle, right, it is unable. So gradually it will increase in its size. That would be the concentric hypertrophy, and that would fail. So that is what is called as the heart failure. In both the cases, heart disease. Right? Why it is associated with hypertension? Because hypertension is what? The pressure generated into the aorta, because that is the pressure which is going everywhere. So against that pressure, left ventricle has to push. Correct? If there is, this is the left ventricle, and from here the aorta is going out, and in this aorta the pressure is high. So then left ventricle has to really push the blood against this. Yeah, symptoms we'll just see. Just a minute. So in heart failure, does the heart stop suddenly? No. Heart never stops suddenly. It for patient, because this thing is also called as the silent killer. When you take the X-ray of these patients, right, and when you say if the heart is enlarged, that doesn't mean it's heart bahut bada hai, dil bahut bada hai. It is not the dil, right? It is heart. Right? So this is like till their heart is enlarged, they might not know anything. This is a silent killer. They never know that their heart is enlarged. What they really know, in case if there is core pulmonary, yes, you will see clubbing of the nails. Right? You will see clubbing, but they never notice. There are so many sign symptoms, but no one notices. Right? Many of the deficiencies you can pick up just by the nail, just by the skin. Right? So this is what really happens, right, in case of failure. The third area which is very commonly affected, renal failure, kidney failure. Renal failure. Well, what happens? This is the aorta. Now we are into the abdomen. Clubbing means the white marks on the nail. Clubbing ka matlab hai, if this is the nail, the finger, right, and this is the nail. So obviously this niche ka portion hai, that is called as the nail bed. Okay? Nail bed. That's what I'm asking that. Right? When this nail bed swells and the nail becomes like this, past mein aapne just check out. Right? Just check out. This is called as clubbing. In one of the PDF, I have shown you the pictures also of clubbing. So this is called as the clubbing. Got it? I showed you. My nails of the toes look like this. Nirman, photo bhejna na. Just send a photo to me. Right? You got the email. Take the photograph from the side. And do one more thing. Sorry. Empty your lung. Right? So take a deep breath, then exhale, and then hold your nose. Right? Mouth shut, nose shut, and start the stopwatch. For how many seconds can you really hold the breath when the lungs are empty? And this is one of the very finest marker, very fine marker about that what is your lung capacity. I mean, why only Nirmal? Everyone can do that. Right? Just try it. On to the renal failure. In case of renal failure, so this is the abdominal aorta. From abdominal aorta at 90 degree, direct, right? Here is the renal artery. This is the renal artery, which goes into the hilum and then it divides and it supplies the. When the pressure is high, the tissues, right? Because the pressure with which the blood will be entering, these are very delicate tissues. That leads to damage. Another important thing that can really happen is this is what is called as the aortic aneurysm, right? Aortic aneurysm. Though we have talked a bit about aneurysm, aneurysm was what? 34 seconds, not bad, quite okay. Between 30 to 40, if it is there, then nothing much to worry about. 30 seconds, okay. So aortic aneurysm is when there is weakness in the wall. And so that this aorta, right? So its wall will become weak, so it will balloon out. Now this is like a time bomb. It can burst very easily because the pressure is over there, right? So it can really break. Sharon, you came just now? Okay. If yes, so the topic is primary hypertension. No problem. Primary hypertension, which is like when the blood pressure is more than 140 by 90, right? That is what is called as the hypertension, systolic, diastolic, right? And we are dealing with the primary hypertension, essential hypertension, which is into 90% of the cases. Secondary for rest of the 10%, these are some of the risk factors. Quite self-explanatory: alcohol, obesity, physical activity, that is lack of physical activity, high salt intake, family history, and specific African or Americans. Sodium intake, that this is very crucial because it leads to increased sodium, that leads to increased plasma osmolarity. There is increased antidiuretic hormone, in the plasma, there is water retention, and that leads to hypertension or the increased blood pressure. These are the associations, right? Stroke, that is the brain stroke. Heart disease, myocardial infarction, and the heart failure. Renal failure, kidney failure. Aortic aneurysm, that is weakness in the wall. Because of the high pressure, the wall becomes weak. And the fifth, and a very dangerous thing, what is called as the aortic dissection. Aortic dissection means when the wall of the aorta itself, it is literally the blood enters into it and it peels it off. It breaks it. So these two are literally killers. Right? They don't occur very frequently, but when they occur, they are like killers. So these are some very common. No doubt, other things are also there. But now comes the hypertension effects. Hypertension effects. We'll divide it into two parts. This is pure pathology. Right? One, what is called as the atherosclerosis. And second, what is called as the arteriosclerosis. Most of the people would say that they both are same. They both are same. Actually not. There is a big difference between both of them. Atherosclerosis. This is the vessel. This is the blood vessel. And in this blood vessel, the inside, this is what is called as the endothelium. Right? Endothelium. In this endothelium, when there is formation of lipid plaques or the fibrous plaque, that means it starts getting collected. Right? Right? Then it becomes more. Then it becomes more. right? So these are called as the plaques. 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 Plaques means collection. And why it should occur? Because of the lipids. Right? That बाहर का खाना. So these are the lipid plaques which are present into the blood vessels. So these are the blood vessels. So when they say that the coronary artery is 60% blocked, so 60% treatment angioplasty. Right? So 60% blocked. So this is when it is 100% open, right? And then this distance is calculated. That how much reduction in the caliber has occurred, and accordingly the judgment is taken. So this is atherosclerosis. That's right. For the treatment, right, there is a stent which is put into it. Right? There is a stent, a tube which is put, so it will keep this area patent, and the blood moves inside it. Means exactly क्या होता है? Plaques means collection. Plaques means a collection. Right? These are the collection. So this acts as a seed. All those lipids, because whatever we eat, right, finally it is going into the circulation. When it goes into the circulation, when the arteries can't it naturally go away, it can really go away. It can. But we'll discuss that thing at the end when we'll be talking about the food. Yes, it can go. But not beyond certain stage. If someone is having 90% block, so then it is difficult. That's why when it is said that when you are at the age of 20 to 25, this is that must period that when your body is at its peak, its power is so high, right? It can literally heal anything. But nowadays you see that people are getting heart attack. Right? Why? Imagine the amount of abuse which they have done to their own body when such a powerful body collapsed. Okay, so these plaques, they are those collections, right? They keep on getting collected. Palm oil. Why palm oil is so bad? Right? Palm oil is no. Palm oil is this only. These are the bad lipids which are getting collected, and they will be collected only into those vessels which are very thin. They won't be getting. They will be into the aorta, right? They will be into axillary artery. They will be into femoral artery. But those arteries are there so powerful, so big, nothing happens. But when it comes to heart, coronary is very delicate. When it goes to brain, so in brain, so they are so small, right? So let's say if this is the brain, this is the Broca's area, which is for speech, and the artery which is supplying to that has gone. Person loses his or her speech. Speech is gone, right? Person won't be able to speak. So imagine the frustration. Which artery is getting affected? God knows. So that's the reason that why your food is so important. When it comes to arteriosclerosis means, remember, it is thickening of artery wall. Lipid profile test is helpful, definitely, surely. And I'll be taking one of the session when I'll be showing you multiple blood reports, real patients. Right? There are hundreds of reports. I'll show you real reports. First normal, then abnormal. Why these levels are important? When someone would show you CBC, right, complete blood test, and you see that WBC is more, so then there is differential count also, and in that differential count, you'll be able to make a judgment that whether to give antibiotic or don't give. Right, this is a viral, automatically ठीक हो जाएगा, right? Or you can detect that he or she must have some allergic reaction. So all those things you can evaluate from a simple blood test, which is not costing even 150 rupees. So lipid profile, it is separate, right? RFT, renal function test, liver RFT, LFT, lipid profile. All those things, yes, in every report there is a science. And once you understand that, it is like when you are watching the report, you are actually watching inside that what is happening inside his body. Definitely, because so many patients report are there. 30,000 placement, that is too dangerous. Less than 90,000 when it goes, so it is a problem. hurts me because of dengue fever. Okay, so arteriosclerosis, when we say it is thickening, right? Thickening of wall, thickening of arterial wall. Now see, there is a reference. The wall itself has become thickened, right? Wall itself has become thickened. Over here, nothing has happened to wall, but the inside caliber is accumulating all those plaques. Arteriosclerosis, they are of two types. One, what is called as the hyaline. Right? It is a type of connective tissue, right? Hyaline. And second one, what is called as the hyperplastic. Hyperplastic. Right now, we'll not be going into too much depth of it, but at least you should be having the idea that what really happens. Now, see, in the case of hyaline hyaline type of arteriosclerosis, right? So here, hyaline it will be having a glassy appearance, glistening, chamakdar, right? Glassy appearance. What really happens in this case? See, high blood pressure, right? Because of high blood pressure, there is leakage of protein via the walls, right? Because see, this is the caliber, this is the wall, this is the wall. The blood is over here. Right? This blood is under high pressure, so that pressure, it literally goes through the walls. Right? It goes, and what is going? Protein. So there will be accumulation of that protein in these areas. Right? Now this thing, and so there is increase blood pressure leads to leakage of protein via walls. This thing is also seen in case of diabetes. Or you can see this thing in case of old age. How to negotiate it? How to prevent it? As your age increases, you start doing the exercise which are more difficult, more powerful. Because when your heart is now conditioned, let's say you are, I'd say 20 saal ke baad, then you'll be at the age of 40. Then there'll be so many collateral circulations, right? Those collateral circulations into the heart. So if one area of the heart is not getting blood via one channel, it is getting via other channel, right? There'll be multiple collaterals. So chances of heart attack decreases. And it is at that point when you will be able to work out very efficiently. But that is directly proportionate to how much work you are doing. That's why any of the exercise, fitness, all those things, if you are taking care of right now, it is like an investment, right? Faida, I'd say this. So this is what is called as the hyaline arteriosclerosis. The second one, which is called as the hyperplastic. Now, in this hyperplastic, this hyaline is more common. This is common. Hyperplastic is pretty less common. This occurs in this. There is ring. Right? There is formation of ring. So if I really draw, right? So if you really take this is how the wall look like. Concentric rings. So the reason behind it is that there is a basement membrane, right? Basement membrane, but a simple is basement membrane. Basement membrane means it is the base on which all the cells are sitting, right? So that is what is called as the basement membrane. So the cells are sitting over here, right? And here. So that's the basement membrane, this base. And over here, this is the caliber. Right? This is the caliber. So that's how the whole artery is. So basement membrane is on which the cells are sitting. But when there is pressure, when there is increased pressure, so this basement membrane multiplies. It looks like similar to Haryana canal. That's right. That's right. So, and actually, when you take next time I'll show you the sections also. Right? These. It really looks like Haryana system. Right? So, this basement membrane multiplies because of pressure. multiplies. Which type of blood pressure? When the diastolic blood pressure, right? When the diastolic blood pressure is more than 120. When the diastolic blood pressure is more than 120, it leads to multiplication of basement membrane, and that gives this type of appearance, this type of concentric rings, right? And this is when the diastolic blood pressure is more than 120. There is other term, what is called as the malignant hypertension. Malignant hypertension. So this is, and when this thing occurs, it leads to lots of problems. One of the commonest problems is retinal hemorrhage. Retina gets damaged, right? There can be kidney failure because such high pressure, the kidney tissues, they are very easily destroyed. There can be MI, myocardial infarction, and these are the things which are very common. Then there is swelling, right? So this is what is called as a malignant hypertension, and it has to be treated like an emergency. Higher systolic pressure, it is still okay. Higher diastolic pressure, it is not at all okay because it is like a constant load on the heart. Right? The third thing, so we learned these two parts, hypertension effect. Atherosclerosis, arteriosclerosis, so this was one, this is second. And the third, very surprising, it occurs very rarely, but must know. That is what is called as the arteriolar rarefaction. Rarefaction means absorbed, or you can say destroyed, or you can say no more present. No more present. Simple. Artery divides, unites, and wave. This is the capillary bed. This capillary bed is important for the purpose because that's how the tissues, they will be getting the blood, right? Tissues will be getting the nutrition. So these are the capillaries. What would happen when these arteries, they close? They are absorbed. Only few of them. All of them, they won't get closed. Only few of them are, they will remain open. Many of them are closed. You can imagine, this is exactly like there were 6 roads. Out of 6 roads, now 4 are closed for some reason. All the traffic will be diverted towards only 2 roads. So traffic is going to rise. So that's where there is increased blood pressure. This is a bit rare. It is a bit rare, but it can occur. So these are the effects of the hypertension. One another important thing about the hypertension. This is normal. Because our arteries, they have got tremendous capability of what's called as the compliance. You remember compliance? Compliance was ability to stretch, right? Compliance was ability to stretch, correct? Ability to stretch. So our normal arteries, they have got tremendous capability to stretch. That means they have got a high compliance. So vessels, they are distensible. They can dilate easily, distensible vessel. So even if there is any increase in blood pressure, no problem, right? They will slightly distend. So now because the area is more, so pressure is adjusted. Due to all the things, smoking and alcohol and all those things, what is really happening over here is stiff vessels. Compliance is decreased. Decreased compliance. And now see, same blood pressure, but because it cannot really expand, in this case it was able to expand, right? It dilated, so blood pressure was adjusted. The idea is the blood pressure should be adjusted. Over here it was not possible and the blood pressure increased 160/100. Blood pressure increased. So stiff vessels. So stiffness, that is more dangerous. Decreased compliance. Another important thing, the normal blood pressure, how do you really know? Right? 120/80. There is one very wonderful thing, pulse pressure. Pulse pressure. It is systolic minus diastolic, so it is 120 minus 80, which is 40. But in such cases, when you see 160 minus 100, right, so the pulse pressure has increased. So increased pulse pressure is the indication of that there is stiff vessel. Right? So this is when even when you take a normal blood pressure, you will be able to come to ECG. You take ECG. High blood pressure is preload or afterload? High blood pressure is afterload, correct? Because that's the left ventricle. Through left ventricle, when the aorta is going and if the pressure is high, so that pressure will be opposing, right? So it is the afterload. Preload was that loaded gun, correct? So this is the afterload. There is increase in afterload. Whenever there is increase in afterload, it will affect which chamber? Left ventricle. So left ventricle will, so there is increased back pressure. When there is increased back pressure, so that will lead to what's called as the classical, it is called as the concentric hypertrophy. Hypertrophy of left ventricle. Concentric hypertrophy. So the walls, they will become like this, right? So what will be? Concentric hypertrophy, these are the tissues, muscle tissues. When they are increased, that means the amount of current which will be passing through them that more. So that means this is like there will be increased voltage, large voltage. This voltage will be going on which side, right? We are having V1 to V6. This is the right side. This is the left side. More muscle mass is over here, so current will be going over there. Correct? Current will be going over there. So it means on V1 side, there would be large S waves, sinking waves, right? Because the current, more current will be going away. So the anything which is going away, that means it will be having that S wave. That would be deeper, sinking wave. They will be deeper, right? And over here, as you come to V5, V6, what would happen? The current is coming towards them, right? So more current will be coming, more current will be going. So it will be having a very strong, large R waves, rising waves. So just remember, large S wave in V1 and large R wave in V6. Total of both of them, more than 35, 100%. 35 millimeter, 100%. We are dealing with the left ventricular hypertrophy. Right? And if it is associated with blood pressure, you can take it that this must be the concentric hypertrophy. So that is the importance of, say, pulse pressure. Always when you take the blood pressure, even when you are taking blood pressure of your parents, dada, dadi, any neighbor, do remember that pulse pressure. How much is the pulse pressure? One of my very good friends, she was a runner. I mean, she is a runner, but I don't know, when we all were running, I found that she became breathless and her breathing pattern was different. And usually I keep all these things with me. Blood pressure, we measured the blood pressure. Imagine someone who has run a marathon and her blood pressure was 168 over 110. रोड पे बिठा दिया because it is that dangerous, because it can it can easily cross 110, 120, and then that will lead to pulmonary damage, retinal damage, renal damage, and whatnot. And all these areas, once damaged, it is irreversible, very difficult. If anything happens to the eye, if anything happens to the kidneys. Okay, now some of the important terms. Whenever in any of the clinical paper, right, in case paper, you see that they say that there is hypertensive urgency. So what I told you was like a hypertensive urgency. When the blood pressure is over 170 by 110, roughly in this range, right? But when we call it urgency, it is not only the number. Keyword, without end organ damage. End organ damage. So that's why you will immediately say, can you see, right? How many numbers? Can you read that? So that way, you are just checking that whether all the ocular functions are okay or not. You are telling that, okay, move your eyes with my finger. So you know that coordination is there, right? You try to ask some complicated things, right? Say that, bolo Czechoslovakia, right? So if the person can speak, that means the Broca's area and other area person can hear properly, that means brain functions are running properly. You ask that how many kilometers have you run? So if someone can accurately say, right, so that means they have got sense of time and space, right, and the distance. So all these features. There would be one session when we'll be discussing about CNS history taking and clinical examination. So before you even touch the patient, some of the questions they can, if you ask, they will give you some very, they even ask the name. That means, can they really identify themselves? Yeah, that is also asked. Very true. Okay. On to the next one. This is what is called as the hypertensive emergency. Right? Let's take it on a new page. It is called as hypertensive emergency. So emergency itself means that the damage has started. Something has been damaged. Right? So over here, if the blood pressure is over 180 by 120, so this is taken for granted, it is considered as an emergency only. Right? It occurs in those patients, those who are already hypertensive, and right, known case, and the medicine stopped. In such cases, known case of high blood pressure. So that means that person was taking medicine. Right? So medicines, they were keeping everything on check. The day medicines they were input, so it led to that rebound phenomena, and that has led to increase. What can damage? Brain, neurological system, and in that, either retina, that is the common, right, retinal hemorrhage, or into the brain, what is called as the encephalopathy. So that is the neural. Very rightly, you must have guessed, that is the renal impairment or the renal damage. So in this case, when there is damage, you'll find that person is having hematuria. There is presence of blood into the urine. This is one. And second is proteinuria. It is said that urine, right, when you go for give the blood, it is called as urine routine micro, right? That's how it is written, like RM. It stands for routine and micro. Right? So in routine, it is that how much, what was the amount, what was the color, what was the smell, etc. And if it is said that urine was extremely yellow, dark, right? So that means when it is a dark urine, when it is extremely yellow, that means person is dehydrated, right? If the color is pale, that means person was well hydrated. But it is in micro, when you get that, is there any presence of blood? No, normally there should not be presence of any blood into the urine. Protein, it has to be absent, right? It is like protein, it is written as absent. If there is 1 plus, then there is presence. 2 plus, more. 3 plus, it is dangerous. So that is what is called as the proteinuria, when the protein starts going into the urine. So normal values are 0. Right? And then there is heart involved, right? Cardiac, which can lead to MI, myocardial infarction, or it can lead to failure. So this is the reason why blood pressure, it is extremely dangerous. The third one, what is called as the malignant. Right? Nowadays, this thing is very rare. It is called as the malignant hypertension, unless the person is so careless. For them, बच्चे is important and इसका husband is important, सास या ससुर ये करना है वो करना है, right? They will be giving importance to themselves last. Most important person are others, right? Which is BS. Because if someone is not taking proper care of themselves, right, क्या मतलब? This thing is seen more common in females. More common when the blood pressure is increased, and when the blood pressure, the diastolic blood pressure, right? When the diastolic, it crosses more than 120 millimeter of the mercury. Diastolic. Normal person systolic is this much. They have got diastolic this much, and then also you'll find that they will say, "No, no, I'm fine." Till one day when the kidney starts damaging, when the retinal hemorrhage is there, or if there is any other damage. By that time, it is very late. So yes, this is so true. कई बार कहते हैं ये डॉक्टर लोग तो भाषण बहुत देते हैं. People have got that mentality that कुछ नहीं. Even what a person whom I am telling about, मतलब जैसे कि यार तू डॉक्टर है ना इसलिए सब कुछ कर रहा है, मैं तो ठीक हूँ, मुझे कुछ नहीं. But the day it worsens, it is so bad. So that's why all of you, say, these are the things which won't cost much. BP instrument, because now you are doctor. BP instrument available in 2 forms. One, digital, right? And second is, that is what is called as the sphygmomanometer. For sphygmomanometer, you will be requiring the stethoscope also. Right? Stethoscope is also needed. This you should definitely buy, because it is easy. Just put the cuff and automatic, and within 2 minutes, in 1 minute, right, you get the blood pressure. Omron is good. I have also got the same one. In fact, I keep one sphygmomanometer is there, but I have got 2. One which is on to the wrist. Right? It is very convenient. It is when we go for run, it is present into the my pocket also. Doctor, the people used to be that need students also over it. तो है ही ना. जिस दिन जब तक कुछ होता नहीं है, like the day if anything happens, it is recently one of my friend has shared those pictures also, but they are ghastly. आपको मतलब खाना नहीं अच्छा लगे. 7 students, those who are in India, you must be knowing this. Right? 7 students. वहाँ पे कहाँ है ये? Deहरादून. Right? all were in the range of 18 to 20 years, heavily drunk, heavily. Right? And Innova was present on the birthday of one of the students, students निकले. At the speed of 160, they rammed this Innova under the trailer. If you really see, तो जैसे आप मतलब एक पेपर लेके उसको you crush it ना, तो the bonnet तो छोड़ो, the dicky was broken. मतलब with that speed they entered. 6 died on the spot, 7th also died because multiple fractures, all the some 9 or 10 ribs were. Oh, Hardik, you know that, ना? हाँ, that's right. This I मैं बोलना नहीं चाहता था, पर आपने जो लिखा, उनका ब्रेन वगैरह दिख रहा था. Exactly. The skulls were broken. Skulls were open. The brains were out. So, and as we are talking about this, ये question मुझे एक senior student ने पूछा था. जैसे थोड़ा तो 170 kilometer and more possible, yeah, possible. 160, 170 was the speed. उसने कहा कि सर थोड़ा अल्कोहल तो चलता है. Right? Now see this. When someone takes 30 ml, right? 30 ml. Now we'll be talking. The topic is as such complete. Now we'll be talking about all the questions what you have asked. First, let me take 2 minutes for the alcohol. 30 ml when it is taken, right? Your decision power that gets reduced by about 8 to 10%, which is okay. Right? Nothing would happen, but still it is not allowed. For driving, you require precision. When it goes to 60 ml, now see the thing. From 8 to 10%, 60 ml, right? It drops to 25 to 30%. This is the drop in the decision power, right? Drop in decision. I know a few people, they say कि हम तो 4 पैग लगाते तो भी कुछ नहीं होता. They can drive. They are dangerous for others. They're dangerous for others. This was the example. बाकी के 6 तो ऐसे ही चले गए. And if it is 90 ml, the fall is, the drop in the decision power is 50 to 60%. So much of fall. And you can think of when it goes to 4th pack, it only 5 or 10% remains. All the reflexes and everything, it gets slowed down. And because this is something which is getting metabolized by the liver has to stop other functions and has to take care of this. So thus person will be having inherent weakness in many of the areas. For the males, it is said that if you really love your partner, right, seriously, right, if you love your partner, never take alcohol, because alcohol literally leads to what is called as the erectile dysfunction and premature ejaculation. These are the things no one discusses, right? But these are important points. And erectile dysfunction, the inability for the erection, that has increased age 30 years. And what is the percentage? 45%. 45%. These are the latest numbers. It has increased that much. And why it is? That in some party and in some smoking also. Yeah, smoking also leads to this thing, because all of them, they are those vessels, they are constricted. The amount of blood which should be flowing with power, it never goes. It never goes. Even just after 4 days, there is marathon, but there is so much of criticism. अरे ये लोग दौड़ते हैं, थोड़े से लोग दौड़ते हैं, सारे रोड बंद कर देते हैं. So that is what. And even I spoke to a few people. I said कि दोस्त तू खाली 10 किलोमीटर दौड़ना. तो कहता नहीं, मेरे पास तो बहुत अच्छी गाड़ी है, हम तो गाड़ी में जाते हैं. Why to strain ourselves so much? So there are reasons for everything, right? But anyway, so this is so important. Moving on to सबसे important, weight loss, right? If any one of you is overweight, don't take it very seriously. ये एज नहीं है. This is not the age to abuse yourself. For weight loss, two things. One is your food. I'm not against, right? Though I'm pure veg, I've never taken eggs. But if someone is eating, I'm not against that. But this is, as you wake up, I'm taking it like you wake up at 6 o'clock, right? 6 o'clock. Plus or minus, chalta hai, you adjust it. As soon as you wake up, start with at least 1 glass of water. Now, when I say something, you'll feel like, hey, it happens. Without brushing your teeth. Without brushing your teeth. Because the saliva which is into your mouth, right, that is so high concentrated. When that goes into the stomach, you'll never develop any of the acidity, hyperacidity. It will never occur. Right? If you can increase it to 1 more glass, nothing like that, you'll never be having constipation. This is very basic, seedha sada, simple apna pani, nothing more, right? But without brushing your teeth. Now the logic, if someone tells kare to fir brush kyun karte hai na? These are the bacteria which are called as the oral bacterial flora. Oral bacterial flora. Right? These oral bacterial flora, they are extremely good for the digestive system. But if someone is having, when someone brushes the teeth and if someone tells mere to khoon nikalta hai, there are bleeding gums. If there are bleeding gums, it is very dangerous. Take care of it. And how much will it cost? 3 rupees. 3 rupiah. Its cost is 3 rupiah. And you know, I'll just, elam, you know, अथवा उसको बोलते हैं फिटकरी, in Gujarati fatakdi. I don't know then other languages, but have you understood? Matlab it is like that stone, patthar jaisa hota hai, right? Aftershave we apply it on beard, right? Aftershave, but aftershave में तो क्या हो, तो मतलब that sophisticated thing नहीं, बिल्कुल अपना देसी, right? Which is costing 10 रुपए का इतना बड़ा पैकेट आता है, 6 महीने तक चलता है, right? The thing is, एक ग्लास लो दोस्त, ग्लास लेके एक बड़ा सा पीस just put it into that, right? And पानी से भर दो, right? And then do the gargles before you go to sleep. And after you brush your teeth, do this. फिर वापस पानी भर के बॉडी ओडर डिक्रीज करती है. बॉडी ओडर मुझे आई डोंट रिमेम्बर. बॉडी ओडर इससे कम होती है कि नहीं मुझे नहीं पता. बट इफ यू गेट दिस ना, ये मतलब कहीं पे भी मिल जाता है, किसी भी स्टोर में मिल जाएगा बहुत इजीली. When you gargle, right, its taste is very stingy, but this is one of the world's best antibacterial. So if someone is having bleeding gums, what really happens is those vessels are open, and via that those bacteria, they can enter into your circulation. The way it is said that carbon dioxide, is it good or bad? Well, the carbon dioxide is bad when it comes to respiratory system, but carbon dioxide is wow when it comes to digestive system. So because apne eno peete hain, right? That in fact it diffuses the acid, it turns it into water and electrolytes. So same way, these bacteria which are okay for the digestive system, they are not okay when it comes to the circulatory system. So when they reach to the heart, then they can lead to so many complications. And yes, it has been said that those whose dental hygiene is not good, they suffer more from heart attack. अब आज के जमाने में मतलब many times when we go for run, right, there is one area, so from there, that is what is called as the Vastrapur. Right? There is a very wonderful lake. उसके आजू बाजू सुबह at 4:30 मतलब वो लारी खड़ी है, मतलब pizza and this and that and all those things. And 2, 3, 5, 10, 15 कार नहीं, कम से कम 50 गाड़ी. And because they serve in the car, oh, वहाँ पे बैठे खा रहे हैं at 4:30 in the morning. So, and when you pass through that area, that smell itself is so horrible. But yes, people do it. और फिर brush करना और वो करना, तो all those, if this is your wonderful tooth, right? This is another tooth. But the thing which has been accumulated in that area, that will really seep and it will lead to all those roots are damaged. And then root canal and this and that, all goes sab chala. Why not to protect these things right from the beginning? So this is one important thing. Water. Do drink water. And if there is any bleeding gum, right, bleeding gums, so this gargling, right, gargles of this water. अब पूरा दिन सुबह किया, then पूरी रात पानी पड़ा रहा, so it will be very concentrated. It will be concentrated water. Don't dilute it. Develop a sense कि कोई बात नहीं, मतलब चलेगा. Do less gargles. बहुत ज्यादा लगे तो ठीक है, 3-4 किए, 2 करेंगे तो भी चलेगा. But yes, I say it like that कि अगर जो this एलम और फिटकरी, if everyone starts knowing about it ना, तो dentist तो भूखे मरे. You'll never need a dentist. So that is one. Then the morning, your brain is tuned for bright light. So in the morning when you wake up, if you really want that for the entire day, you should remain very fresh. 5 minutes, watch the sun. 5 minutes. Not that bright sun, but when the sun is rising, why they say कि यार चलो sunrise देखने जाते हैं? Why? When you see the sunrise, right, those rays, when they go, your retina is activated, directly connected to your brain, and your brain, right? There are specific, so many neurotransmitters, they start and that functions very effectively. But same thing, if at night, if you start watching your cell phones or iPads or laptops, so there is a mode, right, by which it cuts down the blue light. So blue light, that is when you wake you up, and blue light is to be avoided before 2 hours before you go to sleep, 2 hours prior to you go to sleep. So that's why there are goggles available, right, which cuts the blue light. So when very cheaply available, just 200-300 rupees, 200-300 rupees. But yes, I understand that you have to read. So no problem. Use that goggles. Use that. This is just 300 rupees. So easily available, right? But it cuts down the light. So right now, let's say if it is about 7 o'clock, right? So by 9 o'clock, 9:30, if I'm supposed to go to sleep, this 2-hour window, that is crucial. Otherwise, my brain will keep on remaining awake. Right? So this is bright light. Watch the sunlight and see what happens. Within 1 day, you'll feel the difference. You'll feel the difference on the same day. And then up to 12 o'clock, up to 12 noon. Right? Now, this thing might not be very easy when you are into your clinics or when you are into the college, but still you can try. Till this point, don't eat any cooked food. You can have, so whenever I travel, so you can have fruits, you can have that dry fruit, but no cooked food. Then comes the lunch, the normal lunch. No, nothing special, normal lunch. This is when the sun sets. Sunset. Before sunset, you have your dinner. At times, it looks crazy, right? But as soon as I'll finish the class, immediately I'll have it. And my dinner would be very light, extremely light, because the lunch is lavish. Dinner is light. Right? It would be a sort of khichdi, or probiotic chas, like that. Probiotics, they are wonderful because they keep your gut flora very good. Now, because you had consumed less and light, the sleep would be immediate, and when you wake up in the morning, right, your systems, they are absolutely fine. At least 3 liters of water. 3 liters of water. Don't compromise. Never ever compromise with that. Your body requires water for removal of toxins. This much is needed. Many of the diets are, say for example, keto diet. Right? Keto diet, as soon as you start cutting your diet, right, your maximum carbs, max carbs, right, max carbs, it should not be more than 20 grams a day. Now, 20 grams a day, how to calculate? Well, one apple, right, one apple, छोटा सा apple, is apple to छोड़ो, one small tomato. Right? Tomato is having 4 grams of carbs. Onion, one onion is having 6 grams of carbs. एक टमाटो, एक अनियन, 10 तो ये हो गई. Just one burger, burger. You know how many carbs? Any guess? 100 grams of carbs. 100 grams of carbs. That much. So that's why बाहर का खाना. खुशी, तूने पूछा ना कि बाहर का खाना खा सकते हैं. The thing is, दोस्त यार, बाहर का खाना खाओ तो दिस कार्बोहाइड्रेट, उसका तो कोई लिमिट ही नहीं रहता. शादी के खाने में people consume about more than 5,000 calories. 5,000 calories. When we run full 42 kilometers, right, the amount of calorie which you have consumed is 3,200. मतलब running one full marathon consumes 3,200 और एक शादी के खाने में 5,000 कैलोरी, स्पेशली जहाँ पे सब फ्री मिलता हो, right? Unlimited खाना. There are places, unlimited masala dosa, unlimited uttapam, unlimited pizza, lao, right? वसूल करना है. This is that. Right? So the keto diet is as such is good. It gives drastic effect within first 7 days. It is easy to lose weight, but initial weight is 7,700 calories, 1 kilogram बढ़ाता है. Perfect, absolutely. In pounds, 3,500 calorie deficit पे आपका वजन 450 ग्राम कम होता है. So that comes to almost same thing, 7,700 calories per 1 kilogram. Perfectly right. So in keto diet, 7 दिन में आपका वजन कम होता है. But many of the things which are like a water loss. But it is very difficult because the carb craving is so high. मतलब दिमाग पागल करते हैं. I have tried this. Right? I'll be honest, किया था. I lost about 10-12 kilograms. But after that, my capacity to run was कुछ नहीं. मतलब frustration आ गया. So then I figured out that all these diet, paleo diet and juice diet, ठीक है, मतलब बहुत अच्छा लगता है. हाँ, juice पीएंगे, juice पीएंगे, कितना? After 4 days तो मतलब फ्रूट वाले को देख के उसको मारने का मन करे. नहीं, eat everything. And खुशी, कभी कभी सैंडविच आज ही खाए, राइट? कभी कभी मतलब मैदा is bad, sugar is bad, right? It is true, right? Salt तो definitely big no, but कभी कभी मतलब it is okay, right? It is okay. दिल भी खुश रहना चाहिए. So in my refrigerator, yes, there are more than 10 big बड़ी बढ़िया first class chocolates. हाँ, होल डे गोज इन इरिटेशन. ये सब ना खाओ तो मतलब जैसे सपोज आज दौड़ने नहीं गए थे, टुमारो मॉर्निंग देयर आर 4 राउंड्स ऑफ हेवी रनिंग, वेरी फास्ट रनिंग. 4 राउंड्स, पहला राउंड हाई स्पीड, देन वॉक फॉर सम टाइम, अगेन सेकंड, थर्ड, फोर्थ. सो वापस आके मस्त यार एक पीस चॉकलेट का खाए, because you know that you have burned those calories and it is like a reward to yourself. If you don't give reward to your brain won't function, right? So brain definitely works on the principle of rewards. और मैं शरीफ बिल्कुल नहीं, जरा भी नहीं. हाँ अल्कोहल नहीं, बट बाकी कोई शरीफ नहीं. मतलब यू गाइस तो आर वेरी शरीफ. अब हम तो बीजे मेडिकल कॉलेज में तो बाप रे, वी वर लाइक गुंडास. मतलब नेवर यूज्ड टू इंसल्ट एनीवन विद ड्यू रिस्पेक्ट, बट अदरवाइज मैक्स प्रोटीन बार इज गुड. देखना पड़ेगा निर्माण, मैक्स प्रोटीन बार में हाउ मच इज द शुगर कंटेंट. नाम सुना है मैंने, बट आई मीट में तो मतलब बाकी कुछ ना सोचे ना यार, यू नो. सबसे बेस्ट सस्ता भी पड़ता है. आई मीन आई एम नॉट कंजूस, आई एम नॉट कंजूस, बट गो फॉर गुड डेट्स. खजूर, बढ़िया खजूर. गेट one cashew, and put ghee in that. Now this is superb combination. मतलब सवेरे दौड़ने जाने से पहले you have one or two, and that's it. For during the race also, मतलब every individually plastic में पैक करके रखे है. Then on the during the race you can have it, because this is one of the very good carbohydrate. Kaju gives awesome protein, and ghee, which is very much needed. So लोग कहते हैं ना घी बगैर की रोटी, ऐसे क्या है इतना सा घी, बट व्हेन दैट थिंग गेट्स कंबाइंड विद कार्बोहाइड्रेट इट लीड्स टू बेटर डाइजेशन, तो बिंदास खाओ. बट रोटी के साथ सब्जी नहीं, सब्जी के साथ रोटी. हैव मोर वेजिटेबल्स, लेस ऑफ द रोटी. रिसेंटली आई मेट वन पर्सन, मतलब वो सब्जी को ऐसे दर्शन करा था, मतलब छू के बस, मतलब पूरे खाने के दरमियान मतलब इतनी सी सब्जी. दिस इज व्हाट पीपल डू. नो, कई बार बोले ना, अरे खाना अच्छा नहीं है, ये नहीं है. सब्जीज दे आर ऑलवेज गुड, दाल दे आर यूजुअली गुड. हैव दोस थिंग्स मोर. बहुत फर्क पड़ेगा, especially the weight loss. And finally, about what is called as the zone 2 exercise, which by the way कितने लोगों ने शुरू की? How many of you have started the zone 2 exercise? We discussed this thing about some time back also. Maybe about a week or 10 days back we talked about it, especially during that exercise physiology. Anyone who has started zone 2? Okay. If you have started, well and good. If you're not, do this. 220 minus 20, that's your age, right? If it is 18, 19, doesn't matter. 1-2 points here or there. Okay. So 220 minus 20, that comes to 200. In zone 2, right, don't let your heart rate go by more than. So this is your MHR, maximum heart rate. See the advantage. See the advantage. As compared to if someone is 50, right? So straight away it becomes 220 minus 50, that comes to 170. This is the maximum heart rate. That means person cannot go beyond this, right? While you guys, you can safely go at 200. But I'm not telling that none of you should be going to 200, because you need to condition it. This is minimum, nahi, maximum. Minimum, so that is the absolutely low, right? In the range of 50. So that is your resting heart rate. Minimum. This is the maximum. Heart rate should not cross this level, because if it crosses more than 200, so then it can fail like anything. मतलब दौड़ रहे हैं और दौड़ते दौड़ते हट सीखे. During the Baroda full marathon, we saw that. In Surat marathon, max is 110 and Achha, chalo, coming back to this. So you will start doing any exercise. Spot running, right? Spot running karo. Jumping jacks. These are safe. Because you can stop immediately. If you know skipping, fantastic exercise, right? Fantastic. And skipping, there are ropes. I've got those ropes. There are ball bearings. So when you do it, they move so fast. Right? Say my speed is about 160 to 170 per minute. You won't be able to see the rope. It goes that fast. But you do it for 1 minute and your heart rate rises at a good level. And within 1 minute, you feel the warmth in the body. So any of the exercise you do, keep an eye on your heart rate. Your heart rate should not be less than 115 and it should not cross 130. Bas. Keep it into this range. The moment it goes to 132, 135, stop. If you are spot running, start walking slowly. Right? If you are skipping, bilkul hi chhod do. Jumping jacks, stop. Let it come to 125, once again start. But strictly try to keep it in this. This is what is called as the zone 2. Zone 2 training. Zone 2 training, 20 minutes a day. If you are doing it every day. And it is very much easy to do. Else, 100 minutes per week. If you are extremely busy, this is minimum. This is minimum. Right? If you are doing it on alternate day or 3 or 4 times, but 20 minutes to koi bhi nikal sakta hai. If you do it more, it is much better. It is surely better. It will increase your VO2 max. VO2 max. VO2 max was what? VO2 max was that this is artery, this is vein, these are your tissues, right? It will take the oxygen, right? And it will give the carbon dioxide. But this is the concentration of oxygen into the artery, and this is the amount of concentration into the veins. So into the veins only that oxygen will remain, which was not utilized. So this is how much oxygen you can really, your tissues can really utilize. That is what is called as the VO2 max. So this is one of the very good parameter about what is your real strength. Right? And this is what is the indicator of your biological age. That how old is your body. Right? It is, one is chronological, in which you are born and that number. And this is your body's efficiency. Increase that. So this is a very simple, it won't cost anything, but if you do it, right, give time, at least 21 days. Do it every day. On the 21st day, see the difference. Pehle din daud ke dekh lo what is your strength. And do this exercise. After 21 days, just check it, you'll be surprised. Right? It improves even your overall structure. The ability to burn fat, that is mesmerizing. Right? Because this is also called as the fat burning zone. But do it every day. 20 minutes mein can always. There is, as such, the regime is very strict. You have to do it in morning and evening both. 2 baar. Then it becomes still more efficient. Reason? Baaki ke time to baithe rehte. Right? Either it is a lecture or it is kuch bhi kaam. There is hardly any activity. How much calorie gets burned by this exercise? It varies, Rishikesh. If someone is overweight, then they will be burning more calories. If someone is very thin, very light, 50 kilograms, so then they will be burning less calories. Plus, consi exercise. Which exercise are they implementing? If you do skipping, you are burning you are burning calories at a very high rate. Right? If it is spot running or walking, jumping jacks, yeah, because everything is involved. Upper body and lower body both are involved. If someone is spot running, so then they might keep the hands as it is like this. Right? So it varies. It varies. But if you do this zone 2 exercise, definitely there will be reduction in the weight. Plus, keep this diet part into your mind. Right? Very simple. Initially, you might feel like, "Arey, 12 baj gaye, ab tak kuch khaya nahi." No, you can have fruits, you can have vegetables. Jitna khana ho. There is no restriction. But cooked food, to 12 baje ke baad. Cooked food after that only. And shutters down as the sun sets. After 7 o'clock, right, after your 7:30 till next morning. So this is one of the way of intermittent fasting, right, when they say. But this intermittent fasting will be very effective because at 7:30 you have finished your dinner. Right? Now, next morning till 9:30, right, you are not consuming almost anything. So your body will automatically be adapted to that. So thus it will become a very powerful body. Then at a later stage, we'll be talking about that weightlifting. Yes, weightlifting is very good. Everyone should do that. Yes, intermittent fasting will definitely. At times it is said that females should not do weightlifting. No, females should really do the weightlifting, right? Because when it's not needed that on both the sides you just like you put 30-35 kilograms on both the sides, put 4 big plates and do it. No. Even if you do it light, but it will tone up your body very beautifully. I mean, when in that which one was that serial of Priyanka Chopra, where she was that agent? The torso, the upper body which she has developed. Maricom. Quantico. That's right. Quantico. In Quantico, that's right. In Quantico, the upper body which she has developed, so strong. Usually you see it like that. The female heroines, they are delicate, etc. But the way in one of the movie of this also, there was another actress. She was with that rock. Anyway, 12 तक कुछ नहीं खाया तो not even fruit. नहीं, fruits खाने हैं. Fruits खाने हैं. You can have fruits, vegetables. You can have fruits, dry fruits, vegetables, cooked food नहीं. खुशी, cooked food नहीं. 12 बजे तक आपको जो खाना हो खाओ. Right? Fruits are okay, vegetables are okay, dry fruits are okay, green tea is okay, coffee is okay, right? But black coffee. 12 बजे के बाद ही cooked food. Try to do this and see how good you feel. मतलब सबसे बड़ी effect within 3 days, even at the end of the day, you feel like, I'm fine. And the moment you will go to sleep, it is like switch off. Right? Within seconds, you'll go to deep sleep. It's that powerful. Everything self-tested. जितनी भी चीजें बताए. All right. So one important thing, on Saturday we won't be able to meet because Sunday morning is a race, and on Saturday there is that expo, right? Race expo. So that would start at 3 o'clock and will continue till 9 o'clock. So I remain there for the entire time for other runners, etc. So we won't be able to meet on Saturday, but on Thursday definitely we'll meet and we'll take the next part of this, that is the secondary hypertension. Plus some other things we'll see. Right? Where is the race? This is the race. Where it is? Runner's guide. This is Adani and the Patna. So this is 22nd and 23rd. This is Friday, this is Saturday. And that's the route. All right. So thank you so much. Sabarmati River, yeah, Sabarmati River. Those who live in Ahmedabad, go and visit. You are most welcome. Most welcome. All right. So thank you so much. Right. And do take good care of yourself. See you soon. Same to you.